understand these concepts very early in the process of writing your manuscript so that you know how to go ahead to forge ahead in the process of doing research. So I urge you to listen attentively and ask questions when you need clarification. Thank you very much, Dr. Taigbe. Over to you. Dr. Taigbe.
All right. Good morning, Dr. Lowell. Good morning, all. It's a pleasure to be here. So I'll be taking us on research question and research objectives. So my objectives for this session is I want you to be able to know why a research question is important. You should be able to describe the need for a research question at the end of this session. You should be able to formulate a research question, explain the difference between a research question and the objectives, mention the characteristics of a good research objective, and you should also be able to formulate good research objectives. So this is just to give us a reminder of some of the things we already know about what a research is. Research is a systematic collection, analysis, and interpretation of data to generate new knowledge and answer a certain question or solve a certain problem. So in this definition, what's readily important is the fact that there are two major things at the end of that definition. One, it's either we want to answer a question or we want to solve a problem. So that's what research is all about. There's a question you need to answer or a problem you need to solve. So whenever we have that in mind, in fact, the more we keep remembering that, okay, this is a research, there's a question to be answered, there's a problem to be solved, the more we keep remembering that, that helps us in our process, because the research process is all about answering questions, solving problems, right? Now, what exactly, this brings us directly to our talk for today, which is on the research question. So what exactly do we mean when we say a research question? What is a research question? Now, remember we said we want to answer a question or we want to solve a problem. Now, a research question is often generated from a problem statement. And that's why when you are writing a manuscript or you are conducting a research, either it's a student project, it's a postgraduate dissertation or a thesis, or whatsoever type of research work you're involved in, there has to be a problem statement. So you are describing essentially what are the issues that are of interest. That's what the problem statement has to deal with. So once there's a problem statement, you now need to be able to frame your question to align with that problem statement. And research problems, they could arise from either evidence that is scarce, so in which case you evidence for a particular that problem that you have previously stated, there's not much evidence about it. So you want to find out, does Lassa fever, does it cause hearing loss among survivors? Perhaps there's not much evidence about it. You've searched the literature and you don't see papers or studies talking about this. So that's scarce evidence. A research problem could arise from there. Or maybe there's conflicting evidence. So Lassa fever, does it cause hearing loss among survivors? You saw one paper that said, oh yes, it does cause hearing loss. Another paper says, well, it's not exactly very significant. Some may have hearing loss, some may not have hearing loss, but no strong associations have been observed between that. So you may find conflicting evidence. One paper saying one thing, another study saying another thing. And so because the evidence is conflicting, so that has generated a problem. You really want to find out what is the real picture. Could it be that The conflicting evidence might be as a result of poor methodology in one study or the other. Or could it be that really the evidence is not, we really don't know. So we need to generate this knowledge amongst ourselves and know what exactly is the true picture. And that's where, and so that generates for us a research problem. Or it could be that there is poor evidence. So by poor evidence, this has to do majorly with methodological flaws. So you may find out that perhaps maybe a study talking on Lassa fever causing hearing loss. Maybe you read through the paper and you found some glaring errors. Maybe it wasn't. Maybe it was published by a predatory journal, or it was not in a high impact factor journal, or it was in a poor quality journal. And so it wasn't, perhaps maybe it was poorly peer reviewed, or it wasn't even peer reviewed in any case. So the evidence, it's not exactly very strong. So it's poor evidence. So that could also be one way in which research problems could arise from. So these are problems with evidence. Either there's no evidence, there's conflicting evidence, or the evidence available is not really reliable because it's poor, either from the methodology or some other reasons. So, like we said, the research question is generated from a problem statement. So there's a problem you have discovered, then you need to write the research question to put this problem in black and white, put it in an understandable, clear, focused, and concise manner. So those three terms I just mentioned are very important when we need to define what a research question is. Mentioned clear, I mentioned focused, I mentioned concise. So a research question is clear, okay? So it must be very clear. It is focused, okay? So it's discussing or it's talking about one main issue. It must be focused, and it's concise. Again, this is when we come to scientific writing. Scientific writing is one of the major features of scientific writing, academic writing, is being concise. So you don't just write as though it's a literary or an artistic work. There has to be that conciseness in your writing. And so your research question is clear, it's focused, it's concise, and it's that question around which your research work is centered. So why exactly do we need a research question? So for different reasons. And if you're following, you immediately note that all of the things we have mentioned just shows us how extremely important the research question is in the study, in whichever study you hope to conduct. So some of the reasons I've given here. Firstly, it provides clear focus and direction for the study. Wherever your study is going, the direction it's going, everything, it rises and falls on your research question. Because this is the initiation of the study to start with. And so if your question is poorly framed, it affects your methodology. You won't be able to get the appropriate methodology, or if you are going through your literature search, because your question has been poorly framed, you will not even be able to generate, to discover or see literature that are close to what you are trying to work on. Because one thing with research, I'm sure you must have heard this, we are not, the fact that we try to generate new knowledge, we build on things that have already been done. So, I mean, you are not going to do a study that is completely out of the box. What I mean by that, your study is not going to be unique to only you. There would have been people who have done similar things. It may not be exactly the same thing you are working on, but there would have been people who have conversations have been ongoing on that particular issue, all right? And so your study is building up on the works of other people, and that's the importance of a literature search, a literature review. You want to see what other things have people been saying about this particular issue, Lassa fever and hearing loss. What have people been saying about it, okay? And so your research question will provide you that clear focus. It will provide that direction, all right? It will guide your methodology. It will define the scope of your study so that you are working within defined boundaries, because it's very easy to collect data and get carried away and just start doing all manner of analysis, trying to find all manner of associations that are not directly related to your study. So it's a research question that puts you in check, such that you are not just trying to commit what we call p-hacking, just looking for associations all over the place, just trying to find different things. The research question guides the study. Okay, the scope of the study is determined by what your question says, what the research question is. So it's absolutely very important. It also helps in resource allocation. So if you need, of course, studies need to be funded, either they are self-funded or they are sponsor-funded. So resource allocation, once you have your research question, that helps you, because remember we said it defines the scope of the study. So once the scope of the study has been defined, that also helps in knowing, okay, how much funds are going to be allocated, what are the things we need in carrying out this study. Then lastly, it also helps to evaluate our research. How did we achieve our objectives? Did we achieve what we set out to do? Our question, have we answered it? So the conclusion of your study should be the answer to your research question. Okay, so I take that again. The conclusion of your study must be the answer to your research question, because you started out with a question. So you should have an answer by the end of your research. Now, what are the types of research questions? So there are different schools of thought, or there are different classifications you may see if you look through literature. But I've tried to put it down into these three major areas. These are broad, encapsulating almost the different types of questions you're likely to find. So there are the descriptive questions, which what these questions essentially do, they simply describe the features of an entity without making comparisons or examining relationships. So an example is here. What are the common presenting symptoms of COVID-19 among adults in Nigeria? So if I have that as a research question, so it immediately tells me that what I just want to know is symptoms. I want to describe what are the symptoms they present with. I'm not trying to compare COVID-19 symptoms amongst people in Lagos compared with people in Oyo State. I'm not doing any form of comparison. I'm not asking, does COVID-19 cause hearing loss? I'm not trying to do any cause and effect kind of relationship. So it's just simply a description of what I want to know, of what is important to me. What are the common presenting symptoms of COVID-19 among adults in Nigeria? And the second one is the comparative questions. So in comparative questions, what we essentially try to do is to compare, as the name implies. So we're comparing two or more groups. So an example is here. How does COVID-19 mortality rates differ between adults and children in Nigeria? So here we've gone beyond just describing COVID-19 mortality rates. We want to compare those rates between two different groups, two different population groups. We're comparing adults and children. So this is a comparative question. So your question could also be a comparative type of question. Then again, there could be the causal type of question, in which case you want to establish some measure of cause and effect relationship. What is the effect of COVID-19 on mental health? So these are just simplistic examples showing you the different types of questions you may wish to ask when you're conducting your research. It could either be a descriptive question, a comparative question, or a causal question. So having said this, we'll quickly look at the characteristics of a good research question. So firstly, it must be clear. And I will give you examples of this. Secondly, it must be researchable. Thirdly, it must be an important question. Fourthly, it must be feasible. And fifthly, and perhaps most importantly, it must be an ethical question, because research is bounded by ethics. I'm sure you must have had this lecture during your first lecture, which is very, very important. Everything about research, it must be done ethically so that we avoid some of those mistakes of earlier years when certain research misconducts were committed in the past. So now these are some examples. So by clear, what we mean is that you want your question to be as anybody who sees it, who reads it, understands exactly what you want to do. So you are not leaving any stone unturned. You don't just make it vague. You make it as specific and understandable as possible. And so I have some examples here. If I frame my research question as this, is hypertension common around Lagos patients? So that question is not clear. What do you mean by is hypertension common? Are you talking about the prevalence? Are you talking about the incidence? Okay. If you are saying, is it common around Lagos patients? Lagos patients, it's not specific enough. Okay. So then again, is it adult patients? Is it children? It opens itself to so many interpretations and misinterpretations, which is what we don't want. So to rid it of all of those unwanted misinterpretations, we make it as clear as possible. And I've given a better alternative here. And that alternative is this. It says, what is the prevalence of hypertension among adults aged 40 to 70 years attending the general outpatient clinic at Lagos University Teaching Hospital? So you see the difference between this and the earlier one. This has clearly told us what we hope to do without leaving rooms for any form of interpretations or misinterpretations. It's clear enough. Okay, so in generating and developing your research questions, you must ensure that clarity is key. You must ensure that your question is clear to whoever reads it so that they know what exactly it is you hope to do. Now, the second characteristic is it must be researchable. So by researchable, we mean it's something you should be able to test using the scientific method, okay? And scientific method has to do with evidence. So you should be able to collect data, analyze the data, and generate evidence based on what you have done. And so in being researchable, as much as possible, we try to refrain from more of philosophical or ethical or moral, not ethical, moral kinds of things that are not directly observable or directly measurable. Like the example here, it says, should nurses care more about infection prevention? Now, this is something that it may be an important question to ask, okay? But is this really researchable? How do you want to measure this? Okay, what exactly are you going to measure? How are you going to collect data? What evidence are you hoping to derive from the way this question is asked? But if you look at the alternative, this alternative I have presented here could be a way of asking that same question, okay? And now if you listen to it, this says, does hand hygiene compliance among nurses reduce hospital-acquired infections in surgical wards? So we're not just asking a question that we have romanticized in our heads without thinking about the implications of that question or whether it's researchable. But we have thought through it and we have put it down in a way in which we can actually collect data. We can collect data about hand hygiene compliance, and we can get our information to find out, does this reduce hospital-acquired infections? We can collect data about hospital-acquired infections. We can collect data about hand hygiene compliance and create that cause-effect kind of relationship. All right. So that's a better way of asking that question rather than just saying, should nurses care more about infection prevention? Apart from not being clear enough, it's also not exactly researchable. Now, the next one is important. So your question must be an important question. So research, remember, research it costs a whole lot in terms of finance, in terms of human labor, in terms of efforts, so much resources go into research. Then also your participants, a whole lot goes in because they have to, remember one of the things about research, there's almost no research you do that doesn't have some measure of risk. So you don't just want to put people at risk for something that is trivial or flimsy. You want to make sure that if you are doing a research with participants, people have offered to give you their time. Maybe they've offered to give you blood samples. They've offered to give you something from themselves. Then you must make sure that whatever it is you are doing is something important. By important, we mean it's something that is relevant. It's a genuine public health issue or a clinical issue. Okay, it must be something really important. And I've given some examples here. Now it says, do doctors prefer blue gloves or white gloves in the ward? Well, again, this might be arguable. Some people may say, oh, but again, if you really look at this, why, why is this important? Except maybe we've seen studies that tell us that there is something underlying, that blue gloves or white gloves have something to do with the eventual outcome or with infection prevention and control. But if there's nothing like that, I mean, this is just it's just it's so trivial. It's not something you should waste people's time on. Okay. Now you can ask more important questions. What is the effectiveness of early isolation in preventing household transmission of Lassa fever? When you start asking questions that people are interested in researching, people are interested in reading, then you make your questions more relevant, more effective. Okay. And the next one I'll talk about is feasibility. And I've given some examples here. By feasible, we mean something that can be done. And feasibility is relative depending on what it is you are doing. It's dependent on what kind of study you are doing. It's dependent on whether it's a student project. Remember, if you are doing let's imagine it's an undergraduate project, your final year project. You know you have your limitations in time, you have your limitations in budget, you have your limitations in scope. So if you are generating a research question for an undergraduate project, okay, it must be something feasible. It must be something that within the time, the budget, and the scope allotted to you, you know you can handle. Okay, you can't be doing a 1 year or a 6 months project, and you want to ask what is the global impact of malaria control policies over the last 50 years, or you want to find out you want to develop a new cure for HIV within a student project. Okay, so you should temper your expectations. As much as you want to be a high flyer, you should also look at the realistic picture and be feasible. Research is hard work. That's the honest truth. It's hard work. So you must generate research questions that are feasible. What proportion of febrile patients tested at the outpatient laboratories are positive for malaria within a 1 month period? Okay, that's a better research question to ask. Then again, it must be ethical. I can't overemphasize this enough. Whatever research question we're generating, ethics must be involved. We must make sure that we are not harming people. If you remember the principles of biomedical ethics, you want to do no harm. You want to ensure your questions are geared towards the good of the patients or the participants. So make sure it's very, very important. You can't generate a research question asking, does withholding ART from HIV patients for 6 months affect their disease progression compared to those who start treatment immediately? Even though it may be should I call it, it may be something that may be of interest to some people, but it's not ethical. You don't want to, when there is an available treatment, you don't want to withhold treatment from people who need to be treated. That's unethical, okay? So you must ensure when generating your questions that they are extremely very ethical, okay? And that's why we make sure one of the things we do in our protocol development is that it must be submitted to an IRB or an ethics committee to ensure that they look through, an independent body looks through and assesses the ethical considerations within that work. So this is another criteria that has been used oftentimes. I think this was generated by the Elsevier publishers, and it's also it's quite similar to what we've discussed. So this one just talks about feasibility, interesting, being novel, being ethical, being relevant. So some of these words are the same. Feasible still comes into play here. Interesting has to do with being, it's something important, okay? Perhaps the only one that's different here is novel, okay? Which is also very important. So why novelty is important is that you don't just want to, if something has been done in a particular region and the evidence has been generated, it has been peer reviewed, and it's a strong study. You doing that study all over again without anything new, you are not adding anything new to us, because remember, research, it is expected that research is reproducible. So if that study was well done and everything was conducted, and you are also going to do a very good study together with that in the same light, you should have similar findings. So why that's you've not really added much. So novelty is important. So if you are doing a study, you must ensure that you are not just doing this exact same thing somebody else has done. Now, exact same thing, what I mean is that exact same thing in the same population, the same locality. So you could do a similar study to what has been conducted, but in a different population, if there's reason to believe that there are differences in the population distributions or in their population characteristics, that can be done and that's acceptable. But if it's the same exact population group where you have no reasons to think or to believe that there are differences in the population characteristics, it really makes no sense conducting or setting up a research question to do the exact same thing when that question has already been answered, okay? So, this is a brief exercise. What do we think about this research question? What are the effects of exposing people to high levels of air pollution? So you can just put your answer in the chat box. I'll monitor it while we go through. What do you think is good or is bad about this research question? What are the effects of exposing people to high levels of air pollution? So you can drop your answer in the chat box, and maybe I can be going through it as we continue, or at the end, I'll just look through. So because of time, I'll move ahead so we can conclude within the time allotted to us. Now, let's look at research questions. Okay, so okay, someone said the research question is unethical. Precious says that research question is unethical, and I agree it's unethical. So it's similar to what we said. You don't want to expose people. So let me just quickly go back. You don't want to expose people to high levels of air pollution. You are committing harm. And remember, you should do no harm, non-maleficence. You must do no harm. So if your research is doing more harm than good, you shouldn't be conducting that research. All right, so thank you for that response. Okay, it's not clear. Also, it's not ethical. Yes, I agree with that. So good response. Now, how do we formulate research questions? So we've identified, you need to identify what the broad topic is, conduct preliminary research. Preliminary research simply means you are just asking questions. So you're asking questions, you're searching the literature, you're observing, your eyes are very observant. So if you are in the wards or if you are in the clinics, you can observe and find out what people are, what's happening in your environment, right? Then you narrow down the topic and then you frame the question. So how do you frame the question? That's what exactly we need to know. Now there's the this method of framing questions is usually more geared towards clinical research, clinical questions, usually geared towards trials, okay, where you want to know what the population group is, what the intervention is there any comparison, but it also lends itself to almost any important study we want to conduct. You need to know what population you want to work with, okay? So is it amongst boys? Is it amongst girls? Is it amongst children? Is it amongst tobacco, those in the tobacco industry? Is it amongst school-age students? You need to specify what the population is. Then if there's an intervention, you need to let us know what the intervention is. If there's a comparison involved, you need to let us know between who and who. What are the groups you are comparing? Then the outcome of interest is also very important for us to know. what is our outcome of interest, okay? Then also it's important for us to know what is the study design. So this is called the PICOS method, okay? So you know what population group you're working with, what is the intervention that you are involved in, is there a control group, what is the outcome of interest, and what is the study design. Now, let's imagine you have identified a broad topic. And what is that broad topic you've identified? You're interested in vaccination coverage, all right? Again, it's a very broad topic. Now, you can narrow it down to determinants of vaccination coverage in rural areas. And I will even say you can narrow it even further. Which vaccination are you interested in? Okay, so is it HPV vaccination? Is it penta vaccination? Is there a particular type of vaccination you're interested in? So you can narrow down that broad theme, that broad area you have identified, narrow it down to something more specific, and from there frame your question. Okay, so what are the barriers to vaccination uptake among children in rural communities? So let's look at the PICOS. The population group is what? If we look at it, the population group is children in rural communities. So what is the intervention? The intervention, now in this case, we're not looking at intervention, but we're looking at a proxy to intervention. And in this case, it's vaccination uptake. That's what we are interested in, or that's like the intervention in this case, right? Now here, there is no comparison group, so it doesn't apply here. So that tells us that it's not every time you may have a comparison group. And that takes us back to the types of questions we talked about. It may be a comparative question. It may just be a simple descriptive question, okay? Or it may be a causal question. So if there is no comparison group, it's still in order. That helps you to know that, okay, this is not a comparative type of question, all right? Okay, so what is the outcome? So again, outcome does not really apply here, okay, because we are not looking at a cause and effect kind of question. So it's when we have cause and effect kind of question that outcomes really become important, right? Also, on study design, usually that comes, like I said, it's when you have your clinical trials or where you have searches, okay, systematic reviews and all of that, that you need to really follow through with all of those complex, all of the things in that list, right? So this is just another example, a broad topic, acute respiratory infections. We narrow it down to prevalence of self-reported acute respiratory infections among under 5 children in rural areas. And then we generate a research question thus, what is the prevalence of self-reported acute respiratory infections among under 5 children in rural communities of Imo State, Nigeria? So anybody who sees this, it's clear what you really want to do. It's clear what you want to do. It's clear the population group you're interested in. All right. So you have not left it to the interpretation of your readers. Now let's move to how we set our research objectives. So research objectives and research questions, they go hand in hand, even though they are not exactly the same. Some people often use them interchangeably, but there are some subtle differences, okay? So your specific objectives or your research objectives are the steps you will take to answer your research question. So your research question is broader, is the broader thing. Oftentimes you will have your research question and then you have your research objectives, or what we call specific objectives, which will be like those milestones or those steps you hope to take to achieve your research question. All right. So just like your research question, the research objectives are equally very important. Okay. So the same reasons for which your research question is important, same applies to your research objectives. Okay. So it provides direction, it helps in planning, it avoids collection of unnecessary data, and it helps also in evaluation of the study. Did you meet your objectives? All right. Did you meet the set objectives? Did you answer the specific question? Okay. Now we look at the characteristics of a good research objective. And I'm sure you must have heard of SMART. This is where it comes in. So SMART is um, is an acronym that represents specific, measurable, achievable or attainable, relevant, or time-bound. Okay. So specific, again, just like we have for clarity in research question, for objectives, we say specific. Your research objective must be specific, addressing one issue that you wish to solve. It must be measurable. So measurable means you must be able to quantify, or you must be able to have a means of assessing, of measuring that variable that you have talked about. So you can't just like, remember one of the questions we asked the other time where we talked about should nurses care about infection prevention? When you generate questions or objectives in a way that is not measurable, you are not helping yourself. What that just shows is that you have not given deep thoughts to your work. And that's why in your protocol writing, manuscript writing, in your project work, whatever it is, you need to make sure that you really spend some time to conceptualize. You're conceptualizing your work and thinking through what exactly you wish to do. So many times I have some students come to me with certain topics, and on probing them, it's clear that, okay, they've not really given it a deep thought, because if you give it a deep thought, you will notice that some things you have said, I mean, how do you hope to measure this? You need to really think about it. Is this something I can measure? If I can measure it, what am I going to use to measure it? Has somebody else measured it before? And sometimes some people bring up some topics or they bring up some objectives, and they say they've not found any study. They look through and they didn't see. And most times I say it's one of two things. It's either you didn't search well, or if you searched well and you didn't see, there definitely has to be a reason for it. For the fact that people have not looked into that, it means that it's not, perhaps it's not something researchable. And if you had given it a little more thought, you might have realized why people have not done such a study or why people have not talked about that. And that's not to rule out the fact that novelties occur. That's not to rule out the fact that new inventions still occur. But that's just to say that you should give a deep thought. If you are not seeing similar things, chances are that you are not thinking deeply about it to see what the um, limitations are, if you understand what I mean. I don't know if you're getting me. Okay. So your objective, is it achievable? Okay. And achievable has to do with, is it achievable within the limitations of your time, within the limitations of your funding? Okay. Very important. Then they must be relevant. So this also still has to do with importance. It must be relevant. Okay. So you must do something that is relevant. And it must be time bound. So when setting objectives, they must be time bound. So you can't just say to identify or to determine the prevalence of so and so and just stop there. When? Within when? Okay, what period? So there must be that time boundary. That makes for a good research objective. Okay, so now for specificity, if you say to study the nutrition, blah, 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 right? That's not specific because of that's, I mean, what do you mean by to study the nutrition? It's vague. It's vague, okay? So don't make your wordings vague. So use terminologies that are easily understandable and that have meaning. Study has a very broad meaning, but when you say to identify, it shows you want to find out, you want to get something. You want to identify the nutritional deficiencies. So you're not just saying nutrition. Nutrition is broad. You have broken it down to nutritional deficiencies. You want to identify the nutritional deficiencies. Okay, so this is more specific rather than just saying to study the nutrition. Okay, if you say measurability, another example I have here is if you say you want to analyze the diet of pregnant women. Now, this may look okay, but again, thinking about it deeply, you need to be more specific, okay, and make it more measurable. So if you use a word like quantify, that makes it more measurable. You want to quantify iron levels, because if you just say analyze the diet, how do you want to measure that? What exactly do you mean by analyzing the diet? How do you want to measure that? What is your tool or what is your metric for analysis of diet? Okay. But if you say you are quantifying iron levels can be measured, they can be quantified. So this is a measurable example. This is an example of a measurable objective. Okay. So I'll just say, I'm sure you must have read through my slides. I sent them yesterday and I gave some few exercises. So give me examples of give me good, bad, and good examples of achievable, relevant, and time bound. So you can feel free to put that in the chat box. Give me a bad or a good example of achievable, relevant, and time bound objectives. Okay, so um, so in formulating the research objectives, it's almost similar to the way you formulate a research question. So you break down the research question, you define what specific tasks you want to do. Okay, you break it down into specific tasks, you set achievable milestones, then you use action words. This is important. So words like determine, it's an action word. Words like compare, words like identify, words like ascertain, words like describe are words that are action words that also have meaning, measurable meaning. You can determine something, you can identify something, you can compare. Okay, so they have meanings that are researchable and measurable. All right, so but if you use words like understand, appreciate, those are more subjective. They are not really objective measures. I mean, how can you assess that someone understands something? It would be better to say you want to determine or assess the level of knowledge rather than saying to understand. That's not exactly very measurable. It's not exactly objective. Okay. So research questions guide research objectives, while research objectives provide a roadmap to answer the research question. So I've said that. So they're essentially very important. So your research question helps you, it guides your research objectives, while your research objectives provide a roadmap to answer your research question. So at the end of your study, you must have met your research objectives and you must have answered your research question. So quickly, I'll just spend the next 3-4 slides to talk about some common pitfalls. So I just mentioned 3. I think this should be my last slide before I conclude. So again, this is like repeating what I've said. If your questions are vague, if they are overly broad, then you have not helped us, you have not helped yourself, okay? If your objectives are unachievable, this is a very, very red sign, it's a danger warning. You should think through in your conceptualization, think through and make sure that these objectives I'm setting are achievable and be realistic in your expectations, okay? Unachievable objectives, I see them time and time again, especially with, most of us, all of us here are medical students, medical and dental students. We'll be doing our final year projects. Think through this objective I'm setting, is it achievable within this 1 year student project period I have? Okay, remembering the fact that most times you might not really be well funded for it, you have a limitation. So think through those types of limitations that you are likely to face and set for yourself achievable objectives without compromising the other characteristics of your good research question, okay? That it must be relevant, it must be clear, it must be researchable, it must be feasible, it must be ethical. And also, once there is a lack of focus or there is a lack of relevance, then it's also a very, very bad thing we must avoid. So over the last 45 minutes, I've tried to briefly tell us what research questions are. I've defined it for us what a research question is. I've given us some of the characteristics of a good research question and why we need a good research question. And I've also discussed how we can formulate research questions. Okay. Then I've also talked about research objectives, differentiating it from the research question, and how we should have SMART objectives. And I've also discussed how we need to set these objectives. Finally, I have talked about some of the common pitfalls that we should avoid when setting our research objectives and our research question. So I'll conclude by saying the foundation of successful research lies in well-defined research questions and research objectives. They are absolutely very important. You cannot do a rich study or a good study with a bad research question. It guides everything you are going to do in your study. So it's absolutely very important. So I'll stop here and take our questions, take our comments, and take any other contributions. Thank you.
Thank you very much.
Thank you very much, Dr. Taigbe, for that lucid and well-taken lecture on research questions and objectives. I would veer away from the lecture a little and just highlight something you did in your presentation. I'm sure we are going to be having a lecture on presentation towards the end of the program, but I just want to highlight something Dr. Taigbe just did. At the start of his presentation, he highlighted the objectives he wants to attain in this presentation. And while he's ending, he also summarized the key points he wants you to take home so that you have a clear understanding of what you should take home from this presentation. And that's one beautiful way of presenting. I just think it's important to highlight that. So with that, I'll be taking questions. I know there are hands up and there are questions on the chat box. So I'll take Emmanuel first. Emmanuel.
Okay, thank you very much for this lecture, sir. My first question. So, sometimes I'm always confused as to why writing, whenever we're writing research questions and research objective, is there a limit to the number of questions or to the number of objectives that we can include in our why writing research? For instance, is it possible to just have just a single question or a single objective, or the main thing is there a limit? What's the minimum or maximum number? Yeah, thank you very much.
Dr. Tagbe, you want to take that? I want to
Okay.
take all the questions together.
Okay, let's take all of them together.
Okay. Is there any other question? See, most of what I'm seeing on the chat box is acknowledgement, appreciation of the lecture and okay, there is one here. Does your worldview influence your research questions and objective? I think that second one. Yeah. So maybe we'll take this first.
Okay, so maybe after now, I see some hands are also raised up, but let me just answer the ones that.
Okay, yeah, okay.
Or do we take them?
Okay, let me just take many hands
Okay,
up.
fine.
I didn't see them, but I hope you don't miss them in the process. Okay, let me take DK. DK, you
Yes,
can
I'm
unmute
writing them down. I'm writing them down.
Okay, great. DK, go
Okay,
ahead.
good morning, sir. Thank you so much, sir, for the lecture. Please, my question is there a place where we can find these? For instance, if you want to formulate a research question or you want to do a research, is there a place where you can find out if these researches have been done, the data collected and all that, or do we just search randomly on Google? Can we find them, or is there a place where we can, more like a library, where you can find all the researches that have been done so far in the world or something like that, so that I can guide you to know whether these researches have been done, the data that have been collected, and so you know whether to proceed or whether not to proceed with the research. Thank you, sir.
Thank you very much. I'll take Amza.
Thank you very much, sir, for the very insightful session. My questions are, in a study to access the vaccination coverage of medical students and also their risk exposure. So I'm actually at sea. I'm at sea trying to score the risk exposure of the medical student. I don't know if there is and already established measures to actually score this um question, or there isn't. So I'm actually at sea in that regard. So that's my question. Thank you very much.
Sorry, I didn't get that question. I didn't get it, please. Can you take it again?
Okay,
my Dr. Lawa, did you get it? Can you explain?
Yeah, I was going to make comment to that. I didn't get him clearly.
Okay, fine. All right.
Okay, I said I was at sea because I was conducting a study on vaccination coverage among medical students and also their risk exposure, the occupational risk exposure on hepatitis B. So I didn't know because I was using a scoring, a preliminary scoring process. So I'm not sure if it is standard enough to score the risk exposure because it was also low, high, and intermediate. So I wanted to ask if there is a better scoring method for this risk exposure in hepatitis B.
Okay. All right. Amadi.
Good morning, sir. Thank you very much for the lecture, sir. So my question is, I've heard a lot about research gaps. Can you make use of research, like finding out a research gap in a particular area and then now constructing a research question from this research gap? My second question is, you mentioned that the ways that you can check for that research questions could come from reviewing other literature review of other research that has been done in a particular area, and then finding if there is poor evidence in the research that has been done. So my question is that apart from knowing that the journal is a predator journal, what are the other ways that you would be able to know that, okay, this methodology is not, it's not good enough to let there is poor evidence from this research, from this paper that has been written? Thank you, sir.
Okay, and finally, Obasi.
Okay, sir. Good morning. Thank you very much for the excellent delivery. It was a wonderful class. I want to ask, when a person has probably started his research, submitted his research question to the ethics board, gotten approval, and started working on it, is it okay, or is it even possible along the line to see that, okay, maybe you are not getting cooperation, or maybe things are not turning out the way you expected, and you then change your research question in the middle of a research program? Is it possible to change your research question when you have already started?
Okay, I think we have all the questions.
All right, thank you very much for those insightful questions, and I appreciate the engagement in the lecture. Okay, so I will just take them. So the first one talks about objectives, essentially whether there is a limit to the number of objectives, how many objectives. Yeah, so this is a question that keeps coming up and time again. So in reality, this is determined by the body you are working with. What do I mean by that? If it's a student project, for example, okay, ideally that school, if it is your school, should give you those guidelines. Your department gives those guidelines, and most times from experience, I know it's usually between 4 and 5. So if it's 3, 2, it's usually too little. If it starts getting to 6, 7, it's too much. So most times it's the body that determines that. Then if it's a journal, okay, so they are a little bit, it's more different because it's not structured in that format of the full dissertation or project work. They want to be more concise. So they will just tell you to just write out your question. So you essentially write them together. And when writing them together, you may not really itemize them 1, 2, 3, 4, 5 like that. So you try to merge them in one statement or 2-3 statements. Okay, so I think that's how we answer it. But I know we have Prof here. We also have Dr. Lawal here. Maybe they can also give their opinion, give some answer to that and some more context.
Yeah, thank you, Doctor.
Okay.
Let me just build on that. Thanks, excellent for the excellent presentation, and thanks for the question from the student, from the fellow. Just to add, I think when you talk about numbers, there has to be clarity about what we want to do. First, to re-emphasize, like Dr. Tegli says, that your research question is everything. And that's how I would take it. Your research question is the foundation for writing your introduction. So you must, at the beginning, have some level of clarity about your research question. Your research question does not come after your introduction. Your research question is what informs your literature search and informs the introduction. Your research question, it forms your methodology. Your research question is what informs the result you're going to discuss, because if you don't have a research question, like Dr. Tegbe noted, you'll be going here and there. Your research question is what forms your discussion. Your research question is what forms your conclusion. So like Dr. Tegbe noted, your research question is everything. It's the centerpiece. So if you don't define a good research question, you are already working towards a bad manuscript, because you keep fishing everything. You fish the introduction, fish the methodology, fish the result, fish the discussion, and you are really going nowhere. And it doesn't get you into a Q1, Q2 journal. It can get you anywhere. Remember, you can publish anywhere, but what we are doing here are building competency for Q1, Q2. Now, when it comes to the number of research questions, one of the things I have found in writing your research question is that you might truly have only one research question, but break it down to 5, 6, depending on how you write a research question. When you're writing a research question for a thesis, it's supposed to be comprehensive. It's whole in itself. For example, somebody wants to look at a research. What is the association between headache and eye ache? Okay, that's a research question. But somebody can ask the same question in 3 different questions. What is the association between, what is the prevalence of headache? What is the prevalence of eye ache? What is the association between headache and eye ache? That's not 3 questions in reality. It's just a question. Okay, so depending on how well you can write a question, then we will be talking about the number. The number of questions is dependent on where you want to go. Okay, if I'm going to do a PhD thesis, I would not be expected to be asking 5, to be answering maybe 3, 5 questions. But once again, I'm talking about holistic question, in which one question itself is independent of another. Your research design for this question, the entire work you need to do for this question will be different from what you're doing for question 2, question 3, yet they're interlinked. It's just like saying I have a project. I have a project that is going for 10 years. A project going for 10 years is all linked, but I can have 15 questions. So I think it's a complex question in itself that does not have a yes or no. But when you are writing manuscript, remember we're focused here. We're talking about manuscript. I'm not talking about thesis. Please know that for manuscript, read my lips, you cannot, even as a professor that I'm staying with you, you cannot answer more than 1 research question, ideally. If you're brilliant like myself, you will try to answer 2. Once you do 3, you are fooling yourself. You're not doing a manuscript, you're writing a thesis, and it will not link. Okay? And even at me, like I said, I'm brilliant, probably done it once or twice. And I think maybe the second time I ever did it, I had to drop it. I had to drop the second one, because what you say about the research, it's whole in itself. It's all in itself. So by the time you're bringing 2 O's, then you're writing 2 papers, trying to merge it into one, and it's going to go crazy in your analysis point, in your methodology and analysis is going to go crazy. Apologies for taking long to answer that, and it's taking us to the top of the hour. Please would like to ask if you could give us extra 10 minutes so that Dr. Tegbe can briefly answer all the questions. Apologies, over to you.
All right, Ma, thank you very much. Okay, so let me go to the next one. It says, does your worldview influence your research questions and objectives? Okay, so now this question is not exactly very clear what you mean. Usually someone's worldview affects, what do you mean by worldview? Your research question is not clear. Do you mean, because worldview affects almost everything anybody does, so it does that. But remember that in research, you try to also be objective and divorce some of your personal biases from the research. So if it's maybe, okay, you say your research philosophy, again, it's still quite well. Anyway, let me just answer it how best I know to. Your research philosophy, your worldview, those are things that are important. But again, you want to be as scientific as possible. By being scientific, you need to be objective. So if there are some things that are, you have your own predefined notions or biases or subjectivities, those things should be put aside in your research questions. So you go straight with what you have in the literature, make it a scientific process as much as possible. Yeah. But again, worldview affects almost everything someone does. Research philosophy, maybe we can meet later on and talk more about this. This question is asked by my mentee, so we'll talk more about that, Isaac, if that's okay. So let me go to the next one. Is there a place where we can find out? Yes, so there is. You can find out what researches have been done. So we have different databases, all right? So you mentioned Google. If you're using Google, it's not the regular Google you use. Google Scholar, it's more specific, so it shows you some journals, but that's not exactly an academic database. It's just an academic search engine. So you have databases like PubMed. PubMed is really very good. So it shows us, if you can just browse PubMed, so it will take you to their site. So PubMed is a database that has lots of works on almost all works you can see in public health, in health, clinical medicine. You find them on PubMed. There's also Scopus. There's also, I think those are the common ones. Yeah, but for me, once you're able to work with PubMed shows you it's quite comprehensive. So if you search PubMed, you'll be able to see a lot. You can also use Google Scholar. You can check, Scopus is also very important. So those are the ones you can check and you'll see studies. Things are much better now in this internet age. I imagine that in days before now, you would have to physically go to libraries and start searching through journals or hard copy journals, okay, or hard copy materials. But now with the digital age, everything is online. Most of these works, you can search for them online, right? So for me, I'll recommend the PubMed search. It's very important. It's very good. So the person that has a question about vaccine coverage and the scoring system for risk exposure. So that's a subject specific question. So maybe I will not dwell too much on that. It's not directly on our research because that has to do with the subject experts coming to tell you that. So you will find answers to that in the literature. What scoring systems have been used for risk exposure? What other studies that talked about it? What did they do? What did they use? Okay, then if you are going to use your own tool, it should have been validated. Okay, so if you were not able to do a full validation study, then you could take it through face and content validity by meeting experts, maybe your supervisor, meeting professors in that area for them to look through the tool and certify it by face value as being face valid or content valid. All right, so those are things you can also do, but it's a more context specific question, which I recommend you meet the subject experts on that. Then somebody talked about research gaps. Yeah, so research gaps are important, and that's essentially what I was talking about when I was talking about poor evidence, scarce evidence, or conflicting evidence. Those are all research gaps. So when there's poor evidence, it's a research gap. When there's conflicting evidence, that's also a research gap. When there's scarce evidence, it's a research gap. Okay, so it's very important. Then you were also asking, how do we know that the methodology is not good enough? By if you read through research and know. Well, the answer to this is simple. There really is no other way to know than you being informed yourself. So you should have that knowledge for you to be able to detect. So if, for like me now, I can read articles and know articles that are flawed in their methodology, especially when it comes to biostatistics. If I see, and that's because I have that training, I have that knowledge. So if I see somebody doing a chi-square where he should have used a t-test, immediately I know that this is flawed methodology. Or if I see somebody with multiple p-values and did not make allowance for multiple testing, I already know that there's some flaw here in this methodology. So that has to just do with you being knowledgeable in that particular area in research methodology. That's how you'll be able to detect. Then again, like Prof also mentioned, if your work, remember your work can be published anywhere. So one good way is most often than not, works that are published in Q1 journals, you expect little to no methodological flaws because they go through a more rigorous peer review, okay? And they take some time to publish. They don't just come out immediately or instantly. And so those are also some ways you may know, all right? Then the last question here is it possible to change your research question in the middle? Now, I think it's a very practical question, and that's because sometimes you may be doing some studies and you find out some other interesting things, or maybe some things happen that may warrant you modifying. You will not have to completely change, but you may need to modify your research question. Now, if that can be done, but if that is done, you will need to go back to the ethics committee because what was approved for you was the initial question you want to change. And if there's going to be any change, you need to meet them. That's number one. Then the second thing you also need to know is spend some time in conceptualizing your research before you put pen to paper, okay? And that will minimize your having to keep making changes. Because sometimes when some of those changes come, there are changes that would have been avoided if one had really thought deeply, a little bit more deeply, spent more time thinking about the things you need to do. What do I need to ask? What methodology am I going to use? How possible is this? Okay, so if you spend a little more time in conceptualizing, thinking deeply, I think that will also help to avoid that. But again, yes, it's possible to change research question, but if you change it, you need to go back to the ethics committee to secure their approval.
And
So
Dr.
that's how this
Otege,
is.
can I ask that we'll take every other question onto the platform? We need to close down in the next 1 minute.
All right, that's the last question.
All right.
Okay. Thank you, ma.
Excellent.
So
Thank you, everyone.
questions.
I'm sure it's been a beautiful session. Please, every single question you have, please move it onto the platform. This is not supposed to be the end of question time. Please continue on the platform. Dr. Otaigbe will send the assignment on the platform, and hopefully by tomorrow I should give you your scores for the last assignment. On that note, I want to thank you guys for coming here again. I think we missed 1 or 2 persons that's supposed to be in class. I was looking at the numbers. But otherwise, check on each other, be sure you're all well and safe, and have a great week, everyone. Bye.
Bye. Thank you.